Good evening, everyone. It's the fourth in our series of online seminars this evening, and I'm speaking to you to what up to today was Port Elizabeth, and after 210 years, they've changed it to something I can't pronounce. So I will continue saying welcome from PE. We have some interesting things to talk about. Well, I've got some things to talk about. I worked for a long time within change management and wrote lots of erudite papers about it and earned a living going in changing organisations. And change isn't really easy unless it's quite superficial. It's easy to get everybody to agree that they'll have a wage rise, extra holidays, or a new canteen and a bigger office, or a better looking uniform. Things like this are part and parcel of what managers do to keep people happy, and they call it change. Lifetime changes, though, require changes in lifestyle, societal, along with technical and political realignment. This is a hard thing to achieve. Oh, I think I've gone one time too many. No, here we go. Right. In the early 80s, I was involved in a system called FidoNet, which is one of the first bulletin board systems. It still exists. We use dial-in connectivity through acoustic couplers to get onto it. A colleague of mine who lived a couple of universities away was called Tim Berners-Lee, and he kept moaning that using a messaging system which took 24 hours to get round the world seemed a waste of time. Most of us thought it was brilliant because a letter took 3 months to be answered when you sent it to Australia. And on this system, you could get an answer within 2 or 3 days. He, of course, had the vision to introduce us to the World Wide Web. And he set up the World Wide Web Consortium to oversee the development. And he managed to get CERN, who are a very money-minded corporation, to give the whole of the copyright to World Wide Web to us, the populace of the world. He said, the web as I envisage it, we have not seen it yet. The future is still so much bigger than the past. You affect the world by what you browse. And that was early 1990s. I'm afraid the behavior of lots of people on the World Wide Web have shown that it isn't staying the way he would like it. Recently, we've had hackers getting into Donald Trump's campaign. Last week, Google, Facebook banned the news in Australia for all Australians. Trump incited riots on Twitter. I recently was asked to review 11 academic papers for an application for an associate professorship. Academics are supposed to be people who have the highest values of honesty and valuing ethical behaviours. This set of papers, 9 of them are in predatory journals. Unfortunately, there are hundreds of journals now who have no moral or ethical standings and don't have true peer review systems. So much of the stuff that they publish is has no real evidence of proper review. Unfortunately, many of the papers, when we look at them, are copy and pasted from other people's work. Unfortunately, our world of changing behaviour means the populace does not only agree, but actually live and behave in a manner which reflect the values of our society. No, I don't think they got the job after I'd finished the review. There are words appearing as if by magic. Right, I'm going to give our speaker, his full title, Louis Falcon Martin, although like non-speaking Spanish people will reduce it to Louis Falcon. It's a shame my daughter-in-law isn't here because she's from Barcelona. In his speech, Free Software is a catalyst for liberalization, social justice, and social medicine. He defines free software as a movement, as a philosophy, and as a way of activism. To him, the use of proprietary software in the public administration is an anathema, a contradiction by definition. Louis Falcon defines GNU Health as social project with sub-technology behind it. He believes that the university must be a key player in not only teaching health informatics and social medicine to students, but as a crucial actor in reaching out to the community and spreading the value of free software in public administration in general and in public health in particular. I can say that the education working groups of HELINA and SAHIA agree with him completely, and I've been working with open clinical systems in Africa, and have supported the validation of Masters Health Informatics programs with shared curriculum for the same program in 7 countries. And we're now working with 14 French-speaking universities to do the same. When we put these initiatives in, we leave and the country has a university partner, an NGO running the support systems and technical systems, and they join a group of other people. It's not good enough to just provide education. You have to provide the infrastructure so that people can complete it themselves. I thought we'd have got a time delay on the slides, but it's just some small clips. This is an up-to-date photograph because I had an earlier one of him. He's a massive man in the world of open software, FLOSS, as it's properly called. And tonight, in particular, he's going to talk about MyGNUHealth, which is an application that gives control over your health data and keeps a record of our own health. Now, I've tried about 7 systems. I've not tried this yet, so I'm going to enroll on it because I've got multiple pathologies like every 74-year-old in the country. Now, with this focus on privacy, the application is Libre software and provides a way of integrating with the larger ecosystem of public healthcare, while ensuring our data is not being leaked to third parties. That is my biggest problem, and I hate all my personal data ending up being trolled across the network. The application offers different types of functionalities, not only focusing on the physiological aspects of health tracking, but also includes trackers for signs of stress of great importance when monitoring our psychological health. As a long-term mental health practitioner, I couldn't agree more. It is my great pleasure, and I say that without fear of contradiction, to introduce tonight's speaker, who is actually the reason we're all here for the whole series, Dr. Louis Falcon.
Thank you, Professor. It's certainly a pleasure listening to you, and I actually think that I would love to just keep on listening to your talk, and then probably next week myself having another one, because it's really a pleasure and an honor being with somebody like you today here. So the professor was talking about the how hard it is to actually make a change in the society, right? So it's easier to do smaller things, but when we want to, or when we try to change the status quo, we kind of find like a huge brick in front of us, right? And many of these walls are made of crystals, right? So you don't really see them, but you know, the world, the Western society is making such a way that it's just very hard to change the status quo. It's very hard to provide social medicine, to provide social justice, and to, you know, to make sure that all of us have the non-negotiable human right, which is health, right? And that's basically what moved us to create GNU Health. GNU Health as a way of disruptive system, right? As an activism to, again, you know, be able to deliver no matter where you live, no matter how rich or poor you are, state-of-the-art health informatics and equity in healthcare. So what I'll be talking today, both Dr. Brown and Hagen Bichler have been talking about, you know, and Thomas Tarobka, about, you know, the hospital management information system of GNU Health. And today what I'm going to be talking about is this personal health record that it's focused both on privacy and also including these three main components of health, right? So you have the physical, you have the biological, and you have psychological, and of course the social sphere, right? Then we move a little bit more into the components that make the GNU Health ecosystem. And finally, we'll just go through a little bit of the technical details that make up this application, right? So Professor Graham already introduced me. I'm a physician by training. And before I did study computer science and mathematics. And I specialized on genomics and medical genetics. But I'm also an activist. And I'm pretty sure that most of us today here are also activists in terms of, you know, making sure that whatever we have studied and whatever tools we have been able to gain within the years, and whether it's academics or in our work or whatever, we are able to deliver something to those that are the underprivileged, you know, or better said, again, no matter how rich or poor you are, you should be able to have good healthcare system and assistance. And fighting for that is a way of activism, and that's what we try to do by putting our knowledge of computer science and medicine into this ecosystem of set of tools called today GNU Health. This is the start of the project itself. This is back 2006. north of Argentina, where we were doing projects of installing GNU Linux desktops on public rural schools. And then we noticed, and I noticed, that these kids needed more than just technology. They needed, probably more shoes than computers at that time, and better nutrition, so they can actually excel on their studies. And that's what led me actually to go into programming or coding a system for rural medicine at that moment. And then, we introduce all the socioeconomic determinants of health into the system. And then it became a full-blown hospital management information system with different modules and so on. But the DNA of the system itself, the idea, the heart, what moves our project, it's still and is going to be always social medicine and public health. So who's behind GNU Solidario? Well, many people. Formally, we have an NGO that focuses on advancing social medicine. Its name is GNU Solidario, and the idea is that by having GNU Health on NGO, this cannot be bought. This belongs to the people, and anybody that downloads the system at that moment, it belongs to them. So no strings attached, no hidden agendas. This is what we do. Social medicine with a little bit of technology behind. And of course, then we have many friends like the GNU project, and all of the people that actually gets involved within our community, right? So in this slide that we're seeing here, there are projects all over the world, from Argentina to Laos to India, Cameroon, Mexico, and different type of organizations and clinics or very large hospitals as AIMS. Universities, very important, the key. Professor Graham was talking before about how important is the role of the university, the role of the academia in delivering or making a nexus between our community and the academic world itself, right? Because at the end of the day, we studied for something, not just because we love it, but because we want to change the world with our knowledge and with our talent. So very talented people behind the project. We have the United Nations University that many years ago adopted the GNU Health in Kuala Lumpur, the Red Cross, and so on. So it varies a lot on depending what you want to do. The World Health Organization has also adopted it for some projects in Cameroon and so on. So let me move forward a bit. If you want something to be libre or free, in every single component of it must be libre too. That means that, in order to guarantee that whoever is going to use this system is going to feel 100% sure that it belongs to them, you have to make sure that the operating system is libre, that the programming language that you are using is libre, that the documentation is libre, and that the upgrade path it's also free and libre. Meaning, if I go from version A to version B, I must assure that there are not hidden scripts or anything strange that blocks me or locks me into the vendor in order to go within that upgrade path, right? So GNU Health is completely Libre in all these areas. Again, from the operating system to the programming language to the documentation. And all the components and all the libraries that we use, whether it is for encryption as GNU PG, or if we want to integrate it with enterprise resource system as Triton, all of these, or the database of PostgreSQL, all of them must be Libre and must be free in order to the whole ecosystem be widely available and sustainable. So these are the main components of the GNU Health ecosystem. You have, if you have a laboratory, you might want to just install the GNU Health LIMS, Occhiolino. If you work on a hospital, then you will install the hospital management information system that Axel talked a couple of weeks ago. Now, if you want to have GNU Health installed in single board machines like Raspberry Pi or this beautiful Olimex that I have in front, then you will install the GNU Health embedded component. Or what we'll be talking today about, if you want to have MyGNUHealth in your desktop as a personal health record, or if you want to have it on the PinePhone, then you will use MyGNUHealth application, right? Again, don't forget that all this operating system must be free. Otherwise, it doesn't make sense. That's why we don't install it on Microsoft Windows or Mac OS or Android OS, because they are not Libre, right? Now, that said, if you want to install it, then you have the source code and you could do it. But that is not why we are on this community, right? We want to make sure that everything is private and Libre. What you have now in front on this slide, you can see some screenshots from what would be the hospital management information system, right? So you can do from histopathology to growth charts to population pyramid, or you can also do things such as diagnostic imaging, calendaring, and so on. So it's a full-blown hospital management information system, from hospitalizations and demographics and so on. Now, so what is MyGNUHealth? I thought that within these 12 years, we were doing pretty well on doing something for the health professional, right? We coded the system so the health professional, no matter where in the world they were, they could use it to improve the quality of living of the population, right? And that worked very well. But at some point, I felt like we needed something that positioned the person on the driver's seat, right? So we needed to give power to the people. And we didn't have it yet at that point. So I said, well, I guess that we need to go mobile, right? Because many people today have a mobile phone, and we need to bring together the clinician and the person, and make sure that we have some medium that makes them talk to each other. And many times, even without the need of going to the clinic or to the hospital or to the primary care center itself. And that's what it led me to write MyGNUHealth. Now, if we see the technology behind MyGNUHealth, you see that it might get a bit technical, but I just want to give the general idea. It's a Python application that uses the Kirigami and the Qt framework. Matplotlib, all of these are libraries that are Libre, right? As I said before, to generate all these graphics. We needed something that allowed us to store the data on very small devices, right? And also we needed to encrypt, right? When we need to encrypt something, a specific set of data, or we want to digitally sign something, we wanted to use GNU PG. Many of these libraries that you are seeing here, like Matplotlib or GNU PG, are used already on the hospital management information system. And this is great because porting some functionality or even porting some methods from a system that you already know, it makes the development process much easier, right? So we knew Matplotlib already because we've been using it on the hospital management information system. We knew GNU PG, and of course we knew Python, which is the same language that we use for the hospital management information system. So it makes our lives easier, and also you can use the community or many people from our community say, hey, I know this already. I can focus on this specific component of the mobile personal health record, right? And then TinyDB, yeah, this is a bit different, but it's a great JSON-based document-oriented database, and it works beautiful so far. It has a very small footprint, and it allows us to install it from the very large servers to very small single board computers or to mobile phones, right? So as I said, Python is the main language of all of these components that you see here, and it's doing the same for, it doesn't change on MyGNUHealth. That's the main programming language. Now, for those of you that knows Qt, Qt is basically the framework that the KDE Plasma uses, and what is a bit disruptive in this case is that Qt, most of the things that you will see on KDE Plasma and KDE applications are coded on C++. But thanks to Christian Mareira and the team of Qt for Python, or it used to be called PySite 2, now it's PySite 6, but the name is Qt for Python. It allows us to code in Python and make the application as a regular Qt program. What is also very nice here is that the Kirigami KDE framework allow us to, within, or better said, using the same code, the application itself is convergent. And convergent means that I can run it on a desktop and it will adapt beautifully to the mobile phone that you have with you. Right? So same code base, multiple devices, and it's just really nice what they have done. And again, here it comes again the the Libre software community. Now, many communities working together to get different tasks solved. Right. Now, for the technical oriented, this is Python code, right? So basically, you are using all these PySide libraries into MyGNUHealth, so we can deliver a nice looking application like this one, right? So one of the things that convergence brings is that this is what you're seeing right now is MyGNUHealth running on a desktop, as in the one that I'm giving a talk today. And now here it is, the same application on the Pine phone, right? So the layout will adapt to the geometry of whatever device you have at that moment, right? And that saves a lot of time, and it makes it look very nice also. Right? I talked a bit already about TinyDB. It's platform independent, and again, it's a document-oriented database, so it allows you to do very nice searches within your mobile device and within the different contexts. Whether you want to look for something social or you want to look for the socioeconomics determinants of specific disease or condition, it just works beautifully. Now, I think that the other thing that makes MyGNUHealth unique is the fact that it allows us to integrate it within a much larger context, which is the GNU Health Federation. What does it mean? Well, imagine a country with millions of people, citizens, and thousands of hospitals, research institutions, and so on. And we need to aggregate that data, right? We don't want the data to only reside on a single hospital. We want to make sure that the data that is entered on that health facility, you can actually have it in real time in another health facility. So if the patient moves from one place to another within that country, all the clinical record, all the clinical history and demographics are actually updated in real time. And that's what the GNU Health Federation does. Via Thalamus, which is another component of the ecosystem, it integrates all the data generated from research institutions, genomics labs, primary health center, and also in this case, we will be seeing here on the top left side of the slide, that would be MyGNUHealth, right? So it's just bringing the citizen to the driver's seat in the healthcare system. This is just a bit technical, so I'll just move it. Basically saying, just give me where is the federation, and we are ready to go to send the data. Of course, this is done as long as you want, if you want to share your data. If you don't want to share your data with the public health system, that's perfect. You just keep it to yourself. I'm just going to move a little bit faster so we have some time for questions and answers if we have any. This is another thing that that I love. I think that it is a lot to do with medical genetics. That's my area or my focus of specialization in medicine. There are so many conditions today, especially when we talk about how does it actually affect our biology, or how nature is involved on the expression of some genes and the environment, on the expression or not expression of those natural variants that we can see in many proteins, right? So in order to find what is the clinical significance of many natural variants or mutations, we need a lot of data. We need to know, if we really want to know whether that protein natural variant has a significance clinical, you need to know how other people with the same natural variant, what is the correlation between genotype and phenotype? If we don't have that information, what's going to happen is you are going to see what's happening today of unknown clinical significance, right? So yes, you know that you have a mutation somewhere in some specific gene, but you don't really know the correlation between genotype and phenotype. In order to know or to give a bit more of certainty, you need a lot of data. In this case, we were showing here many variant phenotypes from BRCA1, which is involved in different sort of cancers, prostate cancer, breast cancer, ovarian cancers, and so on. And sometimes you just don't know the clinical significance of it. So by having this in MyGNUHealth, you can actually send that variant to research institutions, for example, that have the GNU Health Federation in place. And the more people that does that, the more that we'll know how to tackle that specific variant. First of all, you will know whether that is pathological or benign. And once you have that information, you will have a better prognosis and hopefully a better treatment, right? And the reality is we keep on living in silos, right? And we need to bring open science to our society, right? And in this case, what we're seeing here, it's a real-time observatory that is being used, for example, in Argentina in the context of COVID, right? So there are so many things that you can do with MyGNUHealth and with the GNU Health project in general, not only in terms of the molecular basis of the disease and not only on the social causes of the disease, but also in non-transmittable diseases. We have obesity, you have diabetes, you have heart disease. And when you put all together and when you bring up also epigenetics into it, we talked a bit before about the natural variants and medical genetics and so on. And now we would love to also to know how much is the environment actually causing that problem, that health problem, or if you take it into the social part of it, where are the highest levels of domestic violence? So it's really up to us to bring all this information. Of course, you can do it in an anonymized way, but provide a list if you want, if you wish, all this information so the science, the scientists within the Ministry of Health can actually collaborate, and not only within a specific country, but around the world, right? So the idea is open science is much needed. You know, we need the vaccines to be generated by our universities, and we need. Professor Graham was talking about, you know, how hard it is to make a change. And one of the things that it would be beautiful is all the vaccines as part of our daily health system should be free, and they shouldn't belong to any large corporation or to the big pharma. It should be done by universities, and should be states who should be able to deliver this, and not getting into any sort of lock-ins or any sort of what is the highest bidder to get the amount of vaccine, if any. Just look at Africa. How many vaccines in relation to the rest of the world or to the northern hemisphere are they getting, right? So this is part of activism, right? This is so important, or as important of coding, raising the voice and making sure that everybody, no matter where you are in the world, have the same rights in terms of healthcare. And this is just one example on how we can collaborate with the community. Basically, what we have in front is a hub that allow us to connect to the federation and play with it, with, of course, non-real data, and do your test and check your components and so on. It's open 24/7, and every day it actually resets itself, and it allows us, you know, again, to code our applications and make sure that everything is running well, and so on. This is in Germany, and now there is another one in the US. So with this, I think I finished the presentation, and I think that we have, like, correct me if I'm wrong, Professor or Edgar, I think that we have like 15 minutes for questions.